Hello, Golden Vitality family. Ever wondered how your hormones affect pleasure after 60? In today's honest, doctor-informed video, we'll reveal how senior health changes with age and how safe natural masturbation can still lift your mood, ease stress, and boost emotional wellness. Stay tuned. Your body still knows pleasure. Following a very warm, friendly welcome to you from Golden Vitality. We're so pleased you've decided to spend some time with us today. Here, we believe that navigating our later years, our vibrant 60s, 70s, 80s, and beyond, is a journey rich with potential for continued health, happiness, and connection. Part of embracing this journey fully involves understanding the natural change our bodies go through and feeling comfortable discussing all aspects of our well-being, including those that feel personal. Today, we want to gently explore a topic that intertwines two natural processes, the hormonal shifts that occur as we age, and the personal act of self-pleasure, or masturbation, specifically. We'll look at hormones and masturbation, what changes after 60. Our aim is to provide clear, respectful, and helpful information, much like a caring health advisor would share, empowering you with knowledge about your own body and experiences. We approach this conversation with warmth and understanding, completely free from judgment. Please remember, while we offer these insights for general knowledge, your health journey is unique. This discussion is never a substitute for personalized advice from your own doctor or healthcare provider, who knows your specific health situation best and is always your most valuable resource. Life after 60 often brings a wonderful sense of perspective. We might find ourselves with more time to dedicate to passions like gardening, reading, volunteering, or enjoying the simple pleasure of a walk outdoors, connecting with family, perhaps delighting in grandchildren, or strengthening bonds with friends often takes center stage. These fulfilling activities contribute to a rich tapestry of life. Alongside these experiences, our bodies continue their own journey, undergoing natural changes guided significantly by shifts in our hormones. Hormones are like tiny messengers traveling through our bloodstream, carrying instructions that influence everything from our energy levels and mood to our metabolism and, yes, our sexual functioning. Just as puberty brought a surge of hormonal changes in our youth, the years after 60 involve another set of gradual, natural hormonal adjustments. Simultaneously, our relationship with our own bodies and sexuality continues to evolve. For many people, self-pleasure masturbation, the private act of touching one's own body for pleasure, often leading to arousal and sometimes orgasm, remains a part of life. It can be a source of comfort, stress relief, pleasure, or simply a way to stay connected with one's physical self. Health professionals generally recognize it as a normal, safe, and potentially beneficial activity for adults of all ages who choose to engage in it. But how do the hormonal changes common after age 60 interact with this personal activity? Do shifts in estrogen or testosterone levels alter the experience of self-pleasure? Understanding these connections can help us approach our bodies with more knowledge, acceptance, and self-compassion. It can also guide us towards simple adaptations that might enhance comfort and satisfaction. A quick primer on hormones. The body's messengers. Think of hormones as chemical messengers produced by various glands in your body, like the ovaries, testes, adrenal glands, thyroid. They travel through your bloodstream to different tissues and organs, telling them what to do and when to do it. They regulate countless bodily functions. When we talk about sexual function and changes related to aging, the key hormones we often focus on are estrogen, primarily considered the main female sex hormone, produced mainly by the ovaries before menopause. It plays a crucial role in the development and regulation of the female reproductive system and secondary sex characteristics. It also affects vaginal tissues, bone health, mood, and more. Progesterone. Another key female hormone involved in the menstrual cycle and pregnancy, levels also decline significantly after menopause. Testosterone, often called the main male sex hormone, produced mainly by the testes. It's vital for male sexual development, sperm production, sex drive libido, muscle mass, bone density, and mood. Importantly, women also produce small amounts of testosterone in the ovaries and adrenal glands, which contributes to their libido and energy levels. It's a fundamental fact of aging that the production of these key sex hormones naturally changes for everyone as we get older. These changes are not a sign of illness, but a normal part of the aging process. Let's look at how these shifts typically manifest for women and men after 60 and how they might relate to the experience of self-pleasure. Hormonal changes in women after 60, the post-menopausal landscape. For women, the most significant hormonal shift usually occurs around menopause, which typically happens between the ages of 45 and 55. But its effects continue and can become more noticeable after 60. Menopause marks the end of menstrual cycles and is defined as occurring 12 months after the last menstrual period. The defining hormonal change is a dramatic decrease in the ovaries' production of estrogen. Progesterone levels also drop significantly, while testosterone levels also decline gradually with age. The drop in estrogen is most pronounced and has the most direct impact on tissues relevant to sexual comfort. How lower estrogen affects physical comfort during masturbation. Vaginal dryness and thinning tissues. Atrophy, this is perhaps the most common and impactful change. Estrogen helps keep the vaginal walls thick, moist, and elastic by promoting blood flow and collagen production. With significantly less estrogen, these tissues often become thinner, drier, less flexible, and more fragile. This condition is sometimes called vaginal atrophy or the genitourinary syndrome of menopause GSM. The result during self-pleasure involving touch to the vulva, external genitals, or vagina. This lack of natural lubrication and tissue thinning can lead to friction and discomfort, a feeling of scratchiness or burning, actual pain, increased susceptibility to tiny tears, microabrasions or irritation, potential for bleeding after stimulation. Why lubrication becomes crucial. This is why using an external lubricant becomes absolutely essential for many postmenopausal women to experience comfortable and safe self-pleasure. It's not a sign of inadequacy, it's a practical response to a direct physiological change. We'll talk more about lubricants later. Potential impact on libido sex drive. The relationship between hormones and libido is complex and not solely driven by estrogen. However, some women experience a decrease in spontaneous sexual desire after menopause. This can be related to the hormonal shifts, including the gradual decline in testosterone, but also significantly influenced by factors like fatigue, stress, body image changes, relationship issues if partnered, medication, side effects, or chronic health conditions. Changes in arousal. It might take longer, require more direct or different types of stimulation to become fully aroused compared to younger years. Blood flow to the genital area might decrease slightly due to lower estrogen. Changes in orgasm. Some women report that orgasms feel less intense, take longer to achieve, less frequently. The rhythmic contractions might feel weaker. However, many women continue to experience satisfying orgasms well into later life. What this means for masturbation. The experience might feel different. The primary challenge is often physical comfort due to dryness. Arousal might require more patience and focused attention. Techniques that worked easily before might need adjustment. Hormonal changes in men after 60 gradual shifts. For men, the hormonal changes associated with the aging are typically more gradual and less dramatic than menopause in women. Testosterone levels tend to decline slowly over time, often starting around age 30 or 40, at a rate of roughly 1% per year. While most older men maintain testosterone levels within the broad normal range, these levels are generally lower than in their youth. Sometimes, If levels drop significantly below normal and cause symptoms, it's referred to as late-onset hypogonadism, or sometimes informally and somewhat controversially as andropause. How lower testosterone might affect physical response during masturbation. Changes in erections. Testosterone plays a role in achieving and maintaining erections. Although the process is complex, involving nerves and blood flow too, lower levels might contribute to erections taking longer to achieve, needing more direct physical stimulation to get an erections being less firm or rigid than before, difficulty maintaining an erection as long, changes in ejaculation. Some men notice a decrease in the force of ejaculation or a reduction in the volume of semen produced. Reduced spontaneous erections. Fewer nighttime or morning erections might occur. Potential impact on libido sex drive. Testosterone is a major driver of libido in men, while desire is also influenced by psychological factors, relationship dynamics, and overall health. A gradual decline in testosterone can contribute to a noticeable decrease in spontaneous sexual thoughts or interest for some men. Changes in arousal similar to women. Arousal might take longer or require more focused stimulation. Changes in orgasm. Orgasms might feel less intense or shorter in duration for some men. The refractory period, the time needed after ejaculation before another erection orgasm is possible, often lengthens significantly with age. What this means for masturbation. The experience might require more patience. Achieving a firm erection might take more direct effort. The sensations or the feeling of climax might be different. Focusing solely on achieving a strong erection and forceful ejaculation might lead to frustration if those aspects have changed. Important note, it's not just hormone. While hormonal changes play a significant role, it's crucial to remember they aren't the only factor influencing sexual response and the experience of self-pleasure after 60. Other factors are just as important, if not more so for some individuals. Overall physical health conditions like heart disease, diabetes, arthritis, neurological disorders, or chronic pain can significantly impact blood flow, nerve function, energy levels, and mobility, all affecting sexual function and comfort. Medications. Many common medications for conditions like high blood pressure, depression, anxiety, pain, allergies, or prostate issues can have side effects impacting libido, arousal, or orgasm. Mental and emotional health, stress, anxiety, depression, grief, body image concerns, or past negative experiences can profoundly affect sexual desire and response. Circulatory health. Good blood flow is essential for arousal erections in men. Clitoral and vaginal engorgement in women. Conditions affecting circulation can impact this. Nerve function. Healthy nerve signaling is as vital for sensation and response. Conditions like diabetes or neurological disorders can impair this. Understanding that it's a complex interplay of factors, with hormones being one piece of the puzzle, can help reduce self-blame or frustration if changes occur. How hormonal changes might affect the feel and practice of masturbation. So, bringing it all together, how might these natural hormonal shifts specifically alter the way self-pleasure feels, or how one might approach it after 61? Need for adaptation becomes key. The biggest takeaway is that adaptation is often necessary to maintain comfort and satisfaction. Techniques or approaches that worked effortlessly decades ago might need tweaking. Increased need for lubrication, especially women due to estrogen-related dryness. Using a lubricant often transitions from an optional enhancement to a necessary component for comfortable, pain-free stimulation for women. More time and patience may be needed. Arousal can take longer for both sexes. Rushing the process might lead to frustration. Allowing more time, focusing on sensation, and being patient with your body's response becomes more important. Shift in focus might be helpful. If erections are less firm or orgasms feel different, shifting the focus away from achieving a specific performance goal like a rock-hard erection or an earth-shattering orgasm towards the overall experience of pleasure, relaxation, connection with your body, and stress relief can be more fulfilling. Pleasure exists on a spectrum. Different techniques may be more effective. More direct clitoral stimulation might be needed for women. Men might need more sustained manual stimulation for erection. Experimenting gently with different types of touch, pressure, or rhythm can help discover what feels best now. Sensory experience might change. Some people report changes in sensitivity, either increased or decreased, in genital tissues. Paying close attention to what feels good is key. The good news: pleasure hormones still work. Here's a very important and reassuring point. While the hormonal landscape leading up to arousal and orgasm might change, the beneficial hormones released during and after orgasm, like endorphins, oxytocin, dopamine, and prolactin, are still produced. This means that the potential psychological benefits often associated with masturbation, stress reduction, mood elevation, relaxation, and improved sleep remain accessible even if the physical journey to get there feels different. Your body's capacity to generate these feel-good chemicals through sexual release doesn't disappear simply because estrogen or testosterone levels have shifted. This is why self-pleasure can continue to be a valuable tool for well-being for many older adults. Practical tips: working with your hormonal reality. Knowing about these hormonal changes empowers you to work with your body, not against it. Here are some practical reminders. Lubricate. Lubricate. Lubricate, especially for women. We can't say it enough. Use a good quality water-based or silicone-based lubricant generously. It's the simplest, most effective way to counteract estrogen-related dryness and ensure comfort. Be patient and gentle. Allow more time for arousal. Use gentle touch, especially on delicate tissues. Listen carefully to your body's feedback. Experiment. Try different types of touch, pressures, rhythms, positions, or even assistive devices like vibrators, which can be helpful if manual dexterity is an issue or more intense stimulation is desired. Find what feels good for your body today. Focus on sensation, not just climax. Appreciate the journey of arousal, the warmth, the tingling. Let go of pressure to achieve a specific outcome. Enjoy the moment. Mindfulness: pay attention to your breath and physical sensations. This enhances pleasure and relaxation. Communicate if partnered. If you have a partner, talking openly about these changes can foster understanding and help you explore new ways to experience intimacy together. Prioritize overall health, managing chronic conditions. Taking medications as prescribed, eating well, staying active, and managing stress all contribute to better hormonal balance and circulatory health, which indirectly supports sexual function. When to talk to your doctor. Addressing bothersome changes. While these hormonal shifts are normal, you don't have to simply accept discomfort or significant loss of function if it bothers you or impacts your quality of life. It's time to talk to your doctor if you experience persistent pain during self-pleasure despite using lubricant and being gentle, especially for women. Changes in sexual function, like erectile dysfunction or severe loss of libido, are causing you distress. You suspect medications might be contributing to problems. You are interested in learning about potential medical treatments like, for women, low-dose vaginal estrogen therapy creams, tablets. Rings can be very effective and safe for many women experiencing significant vaginal atrophy/GSM. Systemic hormone therapy might be an option for some, requiring careful discussion of risks and benefits. For men, if testosterone levels are confirmed to be clinically low and causing significant symptoms, testosterone replacement therapy might be discussed again, requiring careful consideration of risks benefits. Medications for erectile dysfunction, like Viagra. Cialis might be an option if appropriate and safe for your overall health. Your doctor can help determine the cause of your symptoms, hormonal, medication-related, other health issues. Discuss your individual risks and benefits of potential treatments, and help you make informed choices. Conclusion: embracing change with knowledge and self-compassion. Yes, hormonal changes after 60 naturally alter the landscape of our bodies, and this can influence the experience of masturbation. For women, lower estrogen often means vaginal dryness, requiring lubrication for comfort. For men, lower testosterone can affect erections and libido, requiring more patience or direct stimulation. For both, arousal might take longer and orgasm might feel different. But understanding why these changes happen, that they are normal hormonal shifts, not personal failings or situations, is incredibly empowering. It allows us to approach self-pleasure if we choose to engage in it with realistic expectations, self-compassion, and a willingness to adapt. It encourages us to focus on the broad spectrum of pleasure, relaxation, and self-connection available, rather than solely on performance metrics from our youth. And importantly, it reminds us that the potential psychological benefits, stress relief, mood boost, better sleep, associated with the release of feel-good hormones remain accessible. Knowledge about hormones gives you the power to work with your body through simple adaptations like lubrication and patience. And it informs you when seeking medical advice might be beneficial. It supports a journey of aging grounded in dignity, self-acceptance, and the ongoing pursuit of well-being in all its forms. Thank you for joining us at Golden Vitality for this open and honest discussion. We hope exploring the connection between hormones and masturbation after 60 has been informative and reassuring. Remember, your body's journey is unique. Be kind to yourself. Listen to its signals and feel empowered by knowledge. If you have specific concerns about hormonal changes, sexual function, or any aspect of your health, please don't hesitate to reach out to your doctor or healthcare provider. They are your best partners in navigating your health journey with confidence and care. Take wonderful care. Stay informed and continue to embrace a life filled with vitality and peace.